This month we are celebrating the hometowns of the Tennessee Valley in a project called Hometown 2031. Tonight, Way 31's Megan Wiebold looks at healthcare in the future and the role Huntsville companies will play.
I think in 2031, Huntsville Hospital will still be here. We've been here since 1895. I think what we treat will probably change.
The future of healthcare could look very different in 2031 than it does now.
Clearly, we're living longer. The longer we live, the more people need to come into a hospital for surgery for certain things, and I mentioned joints and hips and those types of things.
But Huntsville Hospital CEO David Spiller says healthcare should look even more different now.
If you were to ask me this question 20 years ago, I would have predicted that by 2015 we would be much further along than we are. I would have predicted that we would have cures for cancer. I would have predicted that we would have had significant impact on reducing diabetes. The reality is we haven't.
But one thing that could have an impact on that is genomic research.
I would anticipate by that time that we will have tremendous advances in genetics that would allow us the ability to predict what's going to happen to people so that they could be more proactive taking care of things before it's ever diagnosed today.
And that genetics research is being done right here at Hudson Alpha in Huntsville.
I think it's very, very reasonable to think of genomic technologies being as impactful in the future as things that were invented 20 years ago, or how impactful they are now. Cell phones, social media, internet, et cetera, where it'll become a ubiquitous part of healthcare.
Dr. Sean Levy is the director of the Genomic Services Laboratory at Hudson Alpha. He says using the Human Genome Project, which was completed less than 15 years ago, we more than likely will be able to pinpoint risks for other diseases.
And so genome sequencing today is taking an individual's DNA, reading out all of the 3 billion bases that you inherited from your mom and the other 3 billion bases you inherited from your dad, and then compare it back to that reference manual. And then you can, on a personalized basis, tell somebody where they differ in one spot or another, and that's where the information comes with respect to disease.
Things like your risk for getting cancer, diabetes, and other diseases could be pinpointed in 2031 just by genetic mapping.
By then, I'm confident that the routine, it'll be more of a consumer product. The understanding of your genome will begin with the individual, and certainly that's information your doctor will use in your healthcare, much like they use your past medical history, family history today. It'll transition to them using that information in combination with your own genetic information in the future.
And using that genetic mapping, we can better target medicines and treatments for diseases that are uncurable right now.
I think we're really starting to look at it now as a precision medicine, right? That it's personalized to an individual patient, but not limited to genomics. The future will be well beyond that.
In Huntsville, Megan Wiebold, Way 31, First News.
Our Hometown 2031 project continues tomorrow. On First News Morning, we look at the future of the Limestone County Sheriff's Department. Then at 5, the Madison County Sheriff's Department. And at 10, the future of the Huntsville Police Department. And you can see all of our reports on our website, hometown2031.com.